Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you protect and enhance revenue at your hospital. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Welcome back. This is Mike Passanante, and we are very glad that you are here with us again on the Hospital Finance Podcast. And today I am joined once again by Derrick Chavis, who is a manager in our Reimbursement Services team here at BESLER Consulting. And today, Derrick is going to help us understand how providers are paid under the Medicare CJR program. Welcome back, Derrick.
Thank you very much. I appreciate it.
Okay, so right off the bat, can you tell us how will providers and suppliers be paid under the CJR model?
Sure. All providers, including SNFs and their suppliers, will continue to be paid as usual under the fee-for-service payment system. All the rates, the rules, and the procedures will all remain constant. The only difference being that under this new CJR model, upon completion of a performance period, Medicare claims furnished to the beneficiary during the episode will be combined to calculate actual, what's referred to as episode spending.
Can you explain episode spending to us?
Sure. CMS calculates the spending for an episode by summing payments for qualified hospitalizations under MSDRGs 469 and 470, and all subsequent and related Part A and Part B spending for 90 days post-discharge. It's the sum of these costs which is referred to by CMS as episode spending.
So what are the costs that are included in episode spending?
CJR episode spending includes payments to both participating and non-participating physicians, but it does exclude payments to physicians that have opted out of the Medicare program. Capital payments are included in CJR spending calculations. Note, though, that only payments specifically related to a CJR episode are included. If a payment is made for a period that extends beyond the end of the CJR episode, it will be prorated so that only the portion attributable to the period during the episode is includable in that episode's spending. If a payment was made for home health services, for example, that started before the episode and ended during the episode, those costs would also be prorated. CMS estimates that 50% of CJR episode expenditures will be for inpatient care, 15% for physician payments, and 35% for other services and providers.
So, Derrick, how is CMS going to link quality to the payment that providers receive?
CMS has adopted a composite quality score methodology. The composite quality score is a hospital-level quality score reflecting performance and improvement on the two quality measures finalized for this model: THA, TKA complications measure, and the HCAHPS patient experience survey. Successful reporting of outcomes and risk data will be an inherent component of these measures. The composite quality score methodology was adopted to determine, one, the amount of quality incentive payment that may be made to the hospital, and two, the hospital's eligibility for reconciliation payment if savings are achieved beyond the target price.
Okay, so you just mentioned the target price. Can you explain what the target price is, or target pricing as it might be known?
Sure. CJR hospitals will receive separate episode-specific target prices for MSDRGs 469 and 470, each reflecting the differences in spending for episodes initiated by their respective DRGs. In response to comments, CMS will implement a specific pricing methodology for hip fracture patients due to a significantly higher spending associated with these more complex cases. A simple risk stratification methodology will be used to set different target prices for patients with hip fractures within each MSDRG.
So, Derrick, how will cost of care targets be established?
Episode cost of care targets will be established based initially anyway on a mix of both hospital-specific and historic regional spending. eventually transitioning to only regional spending. In early performance years, targets will be established based primarily on hospital-specific historical spending during the 90-day episode, but in later performance years, targets will be established based solely on regional historical spending.
So how is the target price calculated?
CMS will use the 3 most recent years of available claims data for establishing the baseline period for each performance year and calculating the historical benchmark against which actual spending will be compared. Historical benchmarks will be rebased every 2 years.
Can you explain how episode spending and target pricing will be used in determining provider payments?
Sure. CMS will be using both components, episode spending and target pricing, to help them in their determination of reconciliation and or repayment amounts that are made to either CMS or the provider. After each performance year, CMS will perform a retrospective reconciliation of episode spending. Total episode spending amounts will be compared to target prices by calculating what's called net payment reconciliation amount, or the NPRA, which is really just the sum of the amounts above and below the target price for each episode in the performance period. If the final NPRA is below 0, that amount is paid to the hospital as what's referred to as a reconciliation payment, as long as that hospital has met a minimum composite quality score. If the NPRA is above 0, that amount is owed to CMS by the hospital as a repayment amount. It should be noted that hospitals will not be responsible for any repayment amounts due for the first performance year, but may earn reconciliation payments for all performance years.
Derrick, thanks for coming by to shed some light on how our providers are going to be paid under the CJR model.
Thanks.
For more information about CJR, get our new special report at BESLER.com/CJR. This new report discusses how CJR works, describes the responsibilities of anchor hospitals, affiliation agreements, NPRA, and the corrections and appeals process. Again, that's BESLER.com/CJR.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit BESLER.com/podcasts. The Hospital Finance Podcast is a production of BESLER Consulting.